Good morning, everybody. Thank you for joining us today, the Community Partner Outreach Program, for the fourth webinar in our Integrated Eligibility series. We are bringing you ongoing learnings about integrated eligibility, the applicant portal, the upgraded one system, and today's topic is going to be non-Magi eligibility basics. We're very excited to have you all here today and to be sharing this information with you, and then to hear what questions you have so we can help answer them and it will deepen our learning as well. All right, today's scope is we're going to review non-Magi medical program basic eligibility, and we do have some subject matter experts on the line with us today. And we will be including in that questions that you've had in the past, which is what public medical programs are available, especially under the non-Magi scope, for our non-citizens or immigrants. So that is a question we're answering today, and it's peppered throughout the presentation. And lastly, we're going to touch on what state Medicaid programs are available to those on Medicare. And we're going to have a little bit of Q&A peppered throughout as well. So with that, we will get going. This webinar was brought to you by many people who coordinated to bring you a host of information. We have external communications, we have our processing teams for the phones and the emails, we have policy teams for both Magi and non-Magi medical. Back from the processing teams, Joey is here today. We also have David Ballantyne, who kind of covers the scope of all of these things. From the policy teams, we have Christy Taylor and Janelle White. And the Community Partner Outreach Program, I'm Deanna Simon. I'm going to be doing some of the presenting today. Jessica Diaz is also here, and she's helping out. And we have many of our other regional outreach coordinators participating in this call as well. And then we have other integrated eligibility subject matter experts who have been really involved in developing the one system. So we are here today to share and to answer your questions. We have left these stock slides with terminology in this presentation as a reference, but we're not going to go through all of them. I will say that integrated eligibility is the name that we've used for the new system that rolled out that included all of the programs in one. We now are calling it the upgraded one system. So just a little heads up about our dual terminology for the same system. And we're going to be talking today, touching on Magi medical programs, but really mostly talking about non-Magi medical programs, which is the Medicaid programs for individuals who are 65 plus, blind or disabled. And that includes the Medicare savings programs. We hope to do a real strong plug for listening for who might be eligible for Medicare savings programs as an underutilized program. And these programs do have different eligibility requirements than the traditional Magi OHP, as you will see. So we'll talk about OSIP-M basic eligibility, which is the OHP for non-Magi medical. We'll talk about Medicare savings programs, which is also a non-Magi medical program, and then who is available or what is available to those receiving Medicare. Here we go. First, I just want to touch on the basics to make sure that we're all on the same page. So MAGI stands for Modified Adjusted Gross Income. It's how we determine income eligibility. And in Oregon, we have two types of medical benefits that fit under that state medical program umbrella and that people can apply for in the upgraded one system. They fall into two big buckets, the Magi medical programs and the non-Magi medical programs. And that refers to the income types that are counted in each one. So the upgraded one contains the application for both types of medical now. It did not used to. You used to need to send people over to an APD office for certain types of medical, but now it's all in one system. Now, both Magi and non-Magi contain multiple medical programs, and each of those programs have different eligibility criteria. So we are not going to go into all of the details, but we want to help you have a basic understanding of the landscape of the different medical programs that people are applying for and what some of the considerations are. And we'll start you off with a fun fact. The upgraded one system screens for 45 different medical programs. And all those different medical programs have a benefit level associated with them, and we screen for them in a particular order. If somebody is not eligible for one, then we go to the next. If they're not eligible for that one, we go to the next. And there are too many to describe today in detail and to go into all the eligibility. But they all fall into these two buckets of Magi or non-Magi. We are going to be touching on some of the most common ones. And one of those is called assumed eligible for non-Magi. That automatically gets people the OSIP-M. You'll be hearing that term today. That's Oregon Supplemental Income Program Medical, and we'll review that in a moment. But that is the first program that people are evaluated for to see if they're assumed eligible because of other programs they are enrolled in. And after that, we start to look at the Magi programs. And after we screen for the Magi programs, that's then followed by the other non-Magi programs down the list to see what somebody might be eligible for. And again, each program has different eligibility requirements. So we won't be learning everything today. So today's topic is non-Magi medical programs and eligibility. And we want to start by touching on Magi OHP or traditional OHP, just to give us that foundation of what we've all worked with in the past, and then we're going to build on that. So the Magi OHP or Oregon Health Plan includes the programs for children, the child program, the pregnancy program, the OHP adult program, the OHP for caretaker relatives, and it also includes Cover All Kids for children regardless of immigration status. And as you know, I hope, the Magi OHP also has a CALM level benefit. So that first line is full benefits, right? Full OHP benefits, including physical health, behavioral health, dental health, and some vision. CALM emergency coverage is just that. It's emergency only coverage for certain immigrants who might not be eligible for that full benefit package. So OHP has the full benefits and the CALM level benefits. Applicants are determined for the most part, for Magi first, with that one exception, which is the assumed eligible for the non-Magi OSIP-M. And OSIP-M is full OHP, as you'll see. Now, the Magi benefits are not based on need, right? And you'll see in a moment that need means 65 plus blind or disabled. When people have that need, they go into the non-Magi category. But Magi benefits are not based on need. They are for those who are younger than 65, or for those who are 65 or older if they are a caretaker of a child who is a relative. It's based on monthly or annual income. It uses tax filing information. And as you'll see, there are some differences here. The Magi OHP that we're used to has income limits based on the percentage of federal poverty level. So depending on whether you're an adult, a pregnant adult, or a child, you have different levels of different percentages of FPL under which you might be income eligible for that OHP benefit package. And the traditional OHP does not look at resources. So those are some basics about the traditional OHP. And we say that so we can compare it to the non-Magi OHP. The non-Magi OHP is all the other medical programs, and it's for those with a need who might not be eligible for the Magi programs. Because as we go down that hierarchy list, we try to get medical benefits to those who are 65 and over, people who are blind, or people with a disability. It is not based on tax filing information. The income limits are often, not always, but often based on the SSI standard. So we might see, as you will see later, that the income limit might be a percentage of SSI standard, not always based on the federal poverty level like the Magi. And many of these non-Magi programs, especially OSIP-M, have resource limits that apply. We've talked about resources in the past. That's when we look at people's bank accounts, their multiple properties that they might own, multiple cars, annuities, trusts, and all those other resources, those extra questions that you see these days in the upgraded one system. Those are to determine the resource eligibility for the non-Magi programs. And that's new to all of us because it's not needed for the traditional Magi OHP. Now, under non-Magi, the main programs that people are most likely eligible for, and therefore the ones we're going to be talking about today, are OSIP-M and MSPs. So Oregon Supplemental Income Program Medical is OSIP-M, and that is OHP for people who are 65 plus, blind or disabled. There are also Medicare savings programs, which is not coverage, as you'll see, but it's help paying for Medicare costs. And now we're going to go into some details about OSIP-M, this Oregon Supplemental Income Program Medical, the non-Magi OHP. I'm going to pass it over to Janelle if we have sound on her. So let's see if we do.
Hi, everyone. This is Janelle. I'm an APD policy analyst. And all right, let's jump right into OSIP-M. So that is, of course, the non-Magi program for full OHP benefits. So it's full medical coverage. Some of the biggest eligibility pieces that you want to know about that, especially different from Magi, are that need that Deanna talked about, the being aged, blind, or disabled, the income limits, which are different, and then the resource limits. Non-citizens who don't meet immigration requirements can qualify. So that CALWM, the emergency level OHP, applies to non-Magi as well as Magi. And then one other big difference is that OSIP-M doesn't have any kind of different income level for children. So there's no special program like, there's no CHIP type program. There's no special income limits for children. Next slide, Deanna. All right, so what is the need? So we said aged, blind, and disabled. Aged is 65 and older. Blindness, though it's a disability, it's in a special category because there are special considerations for it. It is that they're receiving SSDI for that blindness, so the disability is the blindness, or the SSI, or they can meet blindness criteria by our ODHS rules. So sometimes they may not be receiving Social Security for that blindness disability, but if they have proof of that blindness, they can still be considered disabled based on blindness for our rules. Or they can be grandfathered in, but which means that they've been blind since 1973. We don't see that very often. The other one is disability, and it is not based on age, so it can be a child with a disability as well as an adult with a disability. They may be receiving Social Security disability income, the SSDI from Social Security, or the supplemental security income, or so both of those mean that they were went through the process and got approved and were determined medically disabled by Social Security Administration, as well as meeting their financial eligibility requirements so that they can receive that income. But they can also be referred to the ODHS team called the Presumptive Medicaid Disability Determination Team, who will do their own review if that person is not yet receiving Social Security income. They use the same exact guidelines that Social Security does for that medical disability side. So they will determine independently if that person is medically disabled and can be eligible for our programs. Next slide. Looks like we have a question about the OSIP-M CALWM that I talked about. So the CALWM, what it means is that they don't get full medical coverage. Individuals who don't meet citizenship, non-citizen requirements won't get the full medical package, but they'll get emergency medical, just like CALWM for Magi. Okay, so there are, under the OSIPM program, various types of coverage that you can get, or levels of benefits. And they are based on a lot of different eligibility criteria. And so the main categories, there's assumed or protected eligible. Those ones have special rules and can have some of their income disregarded. There's also what we call the standard living arrangement. The standard living arrangement is what you would think of as the basic standard OSIPM. They're not receiving long-term care. They don't have any special, didn't used to have SSI and any special considerations. It's just the normal income and resource limits, as well as non-financial eligibility ones. Then there's a long-term care, which we often call non-standard living arrangement, because it's not your standard. They're getting long-term care help in their home, or they're living in some form of a facility for that help. Then there's the Employed Persons with Disabilities program, behavioral health services, and acute care settings. And we'll go into those a little more on the next slide. All right, so the main programs for OSIPM, where an individual may not be needing that long-term care service, are assumed and protected eligibility. Those ones all have to do with receipt of supplemental security income. So either they have SSI and they are assumed eligible because they have that, or they are what's considered, it's called 1619B. That's just a code that Social Security Administration uses for those individuals who should be eligible for SSI, but for whatever reason they're not receiving that income, and so they will send a code to DHS to be able to see that, and they are also assumed eligible. And then there's protected eligibility, and these are individuals who may have lost their SSI due to receiving income from a parent's SSA claim, Social Security claim, or due to receiving income from a deceased spouse, or what's called our pickle amendment, which is really complicated and we won't go into that. But just know that the assumed and protected eligible individuals, they don't have income limits apply in the same way that the other programs do, because they're eligible based on those programs. And so that precludes a lot of the other eligibility for our programs. And then, like I said, there's the standard living arrangement. They're not receiving long-term care. They have to meet the SSI standard, which changes each year. And this year it's $794 for an individual and $1191 for a couple. And then there's resource limits, $2,000 for an individual and $3,000 for a couple. And so that's just your straight up, I have a disability or blindness, or I'm aged, and those are the requirements.
Janelle, I do have a question
then
about
if
that.
An individual is, okay.
And it came up in the questions box, so I think this is the time to answer it, which is if somebody is only eligible for the COWM level OSIPM, which is the emergency only OSIPM, is it the same income and resource limits? And would they also fall under this category and just get the emergency level benefits?
Yes, I'm sorry. Yes, so it is the same. Everything for COWM is the same except for that non-citizen requirements. So they must meet all of the income, resources, and any non-financial type of eligibility factor, but except for the citizenship, non-citizen qualification. And because they don't meet that, they don't get the full benefit. They just get the emergency level benefit. Does that help?
Thank you.
No problem. Okay, so a third type of program that has may or may not have long-term care, but they can have it without long-term care, is called Employed Persons with Disabilities. This program is a little bit unique in that it requires that a person be disabled. They cannot be eligible based on age. They must be employed, hence the name of the program. And so this program is geared specifically to help those who have a disability, who want to, become more independent and have a job, be able to keep their Medicaid that allows them to get that job. They must have a disability determination either, and it can be by Social Security Administration or that presumptive Medicaid team that we talked about. They have to meet all the other OSIPM criteria, but they're going to have a different income limit. Their adjusted income is actually going to go by the federal poverty level, and it's got to be less than 250% of that federal poverty level. And then they have higher accountable resources. So instead of the $2,000 for an individual, it would be $5,000 for an individual. And in this program, we don't ever look at spouses. It is only the individual applying. And they cannot be assumed eligible for Medicaid. So if they're one of those assumed protected eligibles, or assumed eligible people with SSI, they won't be able to get employed persons with disability. All right, and if they're assumed eligible, they're not going to have a resource limit either. They're basically assumed eligible in that bypasses those income requirements. Now, all of those programs, if a person's, let's say a person's going along and they're assumed eligible, they're protected eligible, or just the standard, or even EPD, they could also find themselves with a long-term care need. Maybe their health declines or their cognition declines as they age, or they have an accident, whatever it is, they now have a need for that long-term care that can be added on to any one of those three benefits. So the interesting thing about long-term care is that it's kind of a side-by-side program. So you must have OSIPM eligibility in order to get long-term care, but you don't have to have long-term care with your OSIPM, if that makes sense. All of the programs on here are kind of a form of long-term care. So acute care setting is if an individual enters a hospital or a nursing facility due to that decline in health, and they're expected to stay at least 30 days, then they are looked at in every way the same as an individual with a long-term care, except they don't have to meet the level of care because they're in that acute care setting. They're assumed to already have a need for that level of care. And then when they're released, they can go on to long-term care, but they have to be assessed to meet that level of care. So when I say level of care, I mean that an individual, in order to be eligible for long-term care, must have a nursing facility level of care, meaning they need help with eating, bathing, walking, something in those areas that they can't do on their own and that they would need to be in a nursing facility for. And that's a separate assessment by a case manager with APD. Another form of long-term care is behavioral health. We used to call it mental health services, but they've changed the name to behavioral health. That can be in a facility, or it can now also be in the person's home, but is based on a mental health diagnosis being the cause for their need for care, which is different than the typical long-term care we think of through APD, which is typically a physical need for care rather than a mental health basis of need. So with the OSIPM and the long-term care, they get an assessment by an APD case manager. If they meet that long-term care need, and they're eligible for one of those first three, the basic OSIP-M, then it just gets added. But what's great about long-term care is if they have that need, but they have too high of an income to meet any other medical eligibility, OHP eligibility, we actually go ahead and give them a higher standard because of that need. So they can have countable income that is up to 300% of the SSI standard. So 3 times the normal OSIP-M income level because they have a need for care. The resource limit always stays the same. And in the case of long-term care, there's the 5-year look back period that many of you may have heard about. And what it is we're looking for a transfer of assets that may be disqualifying. So if they, in the last 5 years, gave away their home, knowing that they needed to not have resources above $2,000 or whatever it may be, they know that long-term care is a possibility, and so they're getting rid of those assets. That's called a disqualifying transfer, and they're not eligible for long-term care for a certain period of time based on how much they transferred and the value of that item.
Janelle, I'll put a plug while we're waiting for the next slide to show up on your screen, that our next webinar is going to be all about long-term care and going more deeply into that.
Right, and right now we're talking about OSIP-M, but just know that long-term care you can have long-term care with Magi. You just have to have a plus level OHP benefit in order to get the long-term care.
Hey, Janelle, this is David.
All right.
I was just gonna say I popped a few of the questions into the chat so you could take a look at those. Those are the ones that are kind of unanswered.
Okay, gotcha. I'll pull up that chat there. So let's see, I'm assuming that those that don't receive SSI anymore because they were incarcerated for more than a year would fall under the assumed protected eligibility. So those who are incarcerated for more than a year, they lose their SSI, would need to be evaluated once they were released from their incarceration. So they're not automatically assumed or protected eligible. We would have to look at what their status was at that time. For OSIP-M, we have to review everything, and we can't automatically turn that back on. So if they get their SSI back, or if they were in protected eligibility status and that is still there, or maybe they'll be just standard OSIP-M for a while until the SSI gets back. So it's not an automatic thing. And then it says for people over 65 who have Medicare, can they also get OSIP-M? Is this common? We are going to go into that a little more, but the answer is yes. So Medicare can go along with any of these OSIP-M programs. Next question is, does long-term care include those receiving in-home supports through K-Plan? Yes, so long-term care is either the waivered or K-Plan full long-term care. So when I say full long-term care, they have to meet a certain level in order to be the full long-term care. I believe in-home supports that they're talking about is what's called the 20-hour state plan personal care. I don't know that we want to go too much more into that right now. We will have a bigger presentation on long-term care at next month's webinar, but yes, it can include in-home supports. The level of care assessment is done by APD case management. So in the case where an individual is needing those physical needs at home, the eating, the bathing, that kind of thing, or it's a cognitive decline and they're over 65, yes, that is done by APD case management. If this person has a diagnosis of intellectual or developmental disabilities, that would be a a case manager that is from the Office of Developmental Disability Services. They do that assessment. If this is a mental health diagnosis, then the local county mental health entity is going to do that assessment. So it depends on the basis of that need. Okay. Then it says, so the basic difference between CAWM and CAWM OSIPM would be, okay, so there's no standalone CAWM. CAWM is an emergency level benefit that is available to those who meet all the eligibility for, say, Magi. If they meet all Magi eligibility, except they're not meeting that citizenship requirement, they get the CAWM Magi, OHP. If they meet all of OSIPM's eligibility, except they're not meeting that non-citizen requirement, then they get CAWM OSIPM.
Janelle, is there a difference in the benefits that are covered between CAWM Magi or CAWM OSIPM?
No, not as far as I know. It's the same benefit. It's the same CAWM benefit, emergency room only, I believe. It just depends on which program you would have been eligible had you met that citizenship requirement.
Gotcha. But it ends up being the same benefit package, such as it is for
Yes.
the recipient. And okay, thank you.
Yeah. And they don't apply for CAWM. So especially with one, they really don't apply for any specific program. They just apply for medical. They look at everything they're eligible for, and if they don't meet that non-citizen requirement, then they get CAWM OH.
Thank you.
Okay. Did I get all the questions?
Yep, we're good.
Great. Then we're going to move on to Medicare savings plans. And then at the end, we'll have an opportunity for more questions about either Medicare savings plans or anything that was not addressed or that came up again for the OSIPM topic. So, Janelle, now I can't remember who's taking this part. Medicare savings programs.
That's me. I'll go ahead.
Great.
Yep, Medicare savings programs. Okay, so Medicare savings programs are just like the full OHP benefit in that they don't, and a person can't indicate on the one application that they want just Medicare savings programs. They apply for medical, and if they're eligible for this, then they are enrolled in it. They must be receiving or eligible to receive Medicare to be eligible for the Medicare savings programs. And when we say eligible to receive, some people may not have yet signed up, but they are eligible for Medicare Part A. This is not one of those programs that has that citizenship immigration status piece, in that there's no CAWM Medicare, because it's not a medical benefit. It is an assistance with paying for Medicare. If a person has Medicare and they indicate that they're non-citizen, we assume that they meet those non-citizen requirements anyways, because SSA determined it and determined them eligible for Medicare. MSPs are apparently underutilized, but I think they're not well known. So it's something that you want to get the word out there and let your individuals who you're helping know about that program, and that they could get those costs of Medicare covered potentially, which are going higher every single year. So there are 3 programs, but 2 levels of assistance. So our programs are called Qualified Medicare Beneficiary. So it's QMB, and we have our basic level, which is our highest level of coverage. It covers Part A and B premiums and out-of-pocket costs like deductibles and copays. Then the other 2 programs are SMB and SMF. It's 2 separate programs, but they have different income requirements, but they have the same coverage, so level of assistance. They only cover Part B premiums. The difference between these two is that the SMB, for the specified low-income Medicare beneficiaries, technical name, it can be paired with other Medicaid, and as well as the original, the basic. Both of those, the QMB base and the QMB SMB, you can have OSIP-M and even some of the Magi, but we'll go into that later. But you can have OSIP-M and get those at the same time. The SMF, the very bottom one there, you can't have any other, it's called a standalone program. You cannot have any other OHP program and get SMF. So this one has the highest income limit. And so most people, they're not eligible for those other programs anyway. So as you see on the right, the income limits for this year, which do change every March, I believe, is 1,074 for an individual and 1,452 for a couple for that highest level of benefit. And then you can see the ones for the other ones too. I will let you know that we do sometimes consider children in this program if they help the person. So let's say the person has very high income, they're not eligible for QMB, and they have 3 kids who don't have any child support or any income of their own. They can go ahead and add them to the application, making it a family of 4, the individual and their 3 kids. Well, now they're being looked at under a higher income limit and may actually be eligible. So this is a unique program in that they can choose whether they add those children to it or not based on how it helps them. That's good for that screen. All right, questions for Medicare savings programs.
Janelle, I just popped 4 for you in the chat.
Gotcha, thanks.
There might be a 5th that just popped
okay,
up.
so question 1, how do we make sure clients have signed up for Medicare? It sounds like that CPs need to refer them to Social Security before applying for MSP. So no, please just go ahead and get their application in. We have a unit that is specifically dedicated to getting individuals who would be eligible for Medicare savings programs if they had Medicare. They help to get those individuals on it. It's called the buy-in unit. But what they do is they get referrals from the one system for these individuals who are Medicare eligible but not yet signed up, and they make that connection and get those individuals signed up. So you don't have to do anything yourself. Question 2, are MSPs a state provided benefit? Yes. So Medicare savings programs are a state provided benefit to help cover the cost of the federal benefit, which is Medicare. So yes, that's that distinction between state and federal programs. Question 3, are there reduction in benefits for Medicare savings programs during the state of emergencies? No, they are the same as all other coverages. We are not going to be closing Medicare savings programs or reducing the program itself during the state of emergency. That would be against the federal policy. What types of resources income to count in for QMB benefits? Income to count.
Are resources counted for Medicare savings programs?
No, there are no resources. So resources are not considered in those programs. And then income, it's usually the same types of income that are counted for those programs. It's just different income levels. Does the client need to renew every year for MSPs? So yes, in a way. So Medicare savings programs require an interview at initial application. So they're going to go over and review everything with the client over the phone or in person. But at the renewal, the yearly renewal, that interview is no longer required. So the system, so long as it has everything it needs, will go through and just do it automatically. The client may not have to do a single thing for renewal. Okay, so let's see.
So Janelle, that kind of catches you up. We have 5 or 6 more questions. I could kind of keep them coming for now. I don't know where we are on the deck.
We have one more content slide, David, and then more questions, and it's only 9:45, so I think we're good for a few more questions about Medicare savings programs.
Okay, Janelle, I'm going to drop a few for you,
I do
okay?
want to make sure that, awesome. And I'll go ahead and add that plug that people don't apply for Medicare savings programs. Again, with the one system, they apply for medical. And Medicare savings programs are considered a medical program, even though it's not like an insurance benefit. It's a helps pay for Medicare. You can't specify MSP on the application. You just apply for Medicare medical, and we go through all the programs that you may be eligible for. If a client has SMB coverage, does that mean they can also apply for OHP? Yes. So the QMB Basic and the QMB SMB can be paired with other programs if they're eligible. So again, they're going to apply for medical in one, and it will determine if they are eligible for OHP and if they're eligible for Medicare Savings Program, and they could be eligible for both. So they may get OSIP-M and QMB SMB, or the QMB Basic. What they can't get is OHP and the SMF, that third highest level of income limit piece. They can't have any other OHP.
Right.
So they won't ever be eligible for those.
So if they're lower income, they have more options to be eligible for multiple programs at the same time. But once they become slightly higher income, then the ability to be eligible for multiple programs at the same time decreases.
Correct.
I
Yep.
just want to interrupt and reiterate what I've heard a few times, which is like people won't be applying for these different things. They will be filling out the medical application and the system will figure it out. So just reiterating, because I see a few more questions along those lines.
Yep. And for me, the take-home message is everybody should be applying because you never know what they're going to be eligible for. There are 45 programs, and even if they're on Medicare, there still may be something for them. That's my big takeaway.
So the next question is there an income eligibility chart available regarding QMB programs? So we actually just combined all of our medical program eligibility, income and resource eligibility charts to like the current SNAP, daycare, the self-sufficiency one. So there is a form that has all of that information on it. It is a lot, but if you want, I can find the link and we can pop it in there.
Yes, please.
And then you would be able to see what those higher household size income limits are if you wanted.
And Janelle, you can send that to me and I can include it in the follow-up email. Great. David, do we have one more question or should we move on? We have, we're touching next on if people are on Medicare, what else can they be eligible for?
It's called a 50.
Oops, sorry.
Yeah, we have a couple more. No, it looks like Jessica's kind of doing some cleanup. I think we're okay. Let's move on for now.
Okay, because we also have some screenshots of what all of this looks like in both the applicant portal and on an eligibility notice, because those are actually different, so we wanted to call it out. So we're going to move on now to medical programs for individuals on Medicare, because Medicare does not preclude eligibility for many programs. I hope Janelle just made that really clear, but we just wanted to give you a slide to summarize it. That non-Magi programs that can accommodate those on Medicare might be OSIP-M, full OHP, or MSPs, Medicare savings programs to help pay for Medicare costs, or both, right? And then Magi programs, somebody can be on Medicare and also get Magi OHP if they're pregnant, if they're a child in the Medicaid income limit, so up to 138% of FPL. If they are a caretaker of a child who's a relative of theirs, they can be on Medicare and be on Magi OHP under the caretaker relative program. And adults on the former foster care youth medical program, which is up to age 26, I believe, for individuals who were in the foster care system and aged out at the age of 18, they get OHP up to age 26, regardless of eligibility criteria. That status of theirs, having aged out of the foster care system, makes them eligible. They can also be on Medicare and get the Magi OHP. Janelle, did you want to add anything to that? Or Jessica, or anybody?
I hate the silence, but you're doing great.
All right, then. I'm going to move on then and make a note here that we discovered that we wanted to share, which is that when you see which program somebody is going to be eligible for in the applicant portal after they've been found eligible, those program names that you see in the AP are actually different than what you will see in the notice of eligibility, because the applicant portal shows the benefit level, which is actually, I think, more helpful. It really describes what the person is getting, regardless of what program they are enrolled in. But the notice of eligibility, the NOE, gives that code for which program the client is enrolled in. And so it's a good cross-reference as well. So we're going to look at some screenshots here. Here are 3 examples of what it might look like in the upgraded 1 system. So you'll see in the first screenshot that Leah, we've marked out any names here. Leah is getting full medical, right? We don't know if that's Magi OHP or non-Magi OHP or OSIP-M. Not sure it really matters to Leah. She's going to get full medical. Now, Thomas, on the other hand, in that household, is getting the Medicare savings programs, the basic, so that highest level coverage, or that highest level assistance, the Medicare premiums, co-insurance, and deductibles. So it says the coverage type, and that's what it'll look like in the applicant portal. Now, you'll see with the second screenshot, Thomas, in that example, is just getting the Medicare Part B premium payment. So Thomas is presumably at a higher income level and is therefore only getting the Part B premium payment level of benefit. So those are what those 3 programs, or what those many programs that we've been talking about today, might look like in the applicant portal. These are pretty much your options. It might also say, I didn't put screenshots of Callum, but these are some screenshots that we had. Now, if a program is pending or denied, it will not say which program is being pending or denied. It doesn't show a benefit level. It just says pending or denied. So just wanted to call that out, that that's what it looks like in the applicant portal. Then the next slide shows what a notice of eligibility might look like for OSIP-M, for example. So a notice of eligibility will have the name of the person, the program they're eligible for, and it will say the full name of the program, like Oregon Supplemental Income Program Medical Supplemental Security Income. So that person would be assumed eligible because they're on SSI. But the benefit level is OHP plus, right? That's the full OHP benefit level, and it will show a start date and an end date, which is often ongoing. So that's what OSIP-M will look like in a notice of eligibility. And now we're going to take a look at what it looks like for somebody to get the Medicare Savings Program, that higher level benefit, in the notice of eligibility. It will say qualified Medicare beneficiaries, basic, that's the name of the program. And the benefit level, it will just say QMB. So whereas it would really describe what that benefit level looked like in the applicant portal, it won't say that in the notice of eligibility. Presumably, and maybe Sam Brookshire on the line or somebody else can help. It says new clients will get more information about the benefits in the mail. So I actually don't know what that looks like, and maybe that will have more information. But we did want to call out the differences there. And I'll pass it on to our subject matter experts to speak to that last question that I had.
That's going to be the welcome packet, Deanna. Yeah. the welcome packet that they'll receive that includes their medical cards and information about their CCL. We'll give them that whole kind of idea of what they can, how they can use their medical coverage.
Excellent, thank you. All right, so those are our screenshots, and what we have now is an open Q&A time for any questions about any of the content today. So I'm going to hand it back over to David to manage those questions.
First off, I would just say there's a piece of feedback from Ada that they imagine the notices will be confusing for members or are confusing for members. So just wanted to share that with the group. And then Janelle, I did share a question that we have in the chat.
So do APD offices help people apply for the LIS prescription program that helps Medicare folks before their prescriptions? So yes, this is the low income subsidy, that's the LIS prescription program, and that is something that that we can help people apply for. I believe, Sam, maybe you can help me, but I believe there is an LIS referral that is automated in the one system. So even if they apply in one, they may be able to get that referral sent. Oh, and for the Medicare Savings Program, there was a question about how long it takes them to get processed, I guess, after applying in one. So a person applies in one, they may be approved through the one system pretty quickly, but that doesn't mean that they will immediately see those premiums, those Medicare premiums, no longer being taken out of their Medicare amount, their SSA amount. That sometimes can take up to 3 months for the Social Medicare to process that approval and that the state is paying. And what will happen is after it actually goes through and gets processed, they'll receive a refund of those previous 3 months or however long it took, those premiums when this state should have been paid. That makes sense? So it may take a while, but they will get that money back, basically.
Hey, Janelle, this is David. I just want to hop in and ask, there's a follow-up. We want to make sure we didn't miss one question. Does the MSP help cover nursing care? Did we end up getting an answer to that one?
No, we I need to make sure everyone understands MSPs are not insurance. They don't cover anything. What they do is help pay for Medicare, and then someone would need to see if Medicare covers the nursing facility or whatever benefit they're needing to be covered by that insurance. So Medicare savings programs are not any kind of insurance coverage. That's why getting an OHP benefit package along with MSPs is like the best scenario, because not only do they get the insurance coverage from Medicare, who will pay first, then they'll get the insurance coverage from OHP, which will help with those additional costs. And then the Medicare Savings Program helps them pay for the premium for their Medicare. So it should be almost nothing out of pocket in that scenario.
Okay, great, thank you.
Okay,
and then
so
I have a couple more that I just popped in the chat for you.
Yeah, okay, so the next one was, what is confusing is that folks will get a notice that says OSFM denied, QMB ongoing, and they don't know what it means. They call Sheba a lot for an explanation. Yeah, those notices are confusing. I believe there are some changes in the works for the notices to hopefully help them be less confusing, but they can also call a local office or the VEC if they're trying to understand what program they're actually eligible for through APD or Magi too, if they misunderstand a notice. But Sheba is also, especially for Medicare type items. They're a good source too. I don't have a good answer for that. They can be confusing if they don't know what OSIPM and QMB even are. And the next one, I believe, is if you believe that a senior 65 plus couple qualifies for MSP or OSIPM but was previously denied when applied through the one system, what should your line of action be? So anytime someone disagrees with a decision, they can submit a hearing request, and then that hearings representative will look into the case, review the rules, and review everything that was done and see if there was a mistake. And if there was a mistake, we can reverse it. A lot of times they'll talk with us in policy and we'll figure out what happened and if the action was correct or not, and corrected if it was not, before ever getting to any kind of actual hearing where the person has to call in and talk to administrative law judge. But they can also call customer service if they have questions about why they were denied, or if they think that it was incorrect, and that's probably a good place to start. And if that person can't fix it, if it needs fixing, or if that person says it's accurate and that individual still disagrees, then they can do the hearings request.
I also want to put in a
Another
plug.
question was if someone has a Medicare Advantage plan.
Sorry, I just wanted to put in a plug that the
Go ahead.
Oregon.benefits email is for community partners to use, and you referred to, emailing or calling, but the Oregon.benefits email is also available to clients. So if a client wants to communicate with the system, with the program, they can do that through that email.
Right. So if someone has a Medicare Advantage plan, can they still qualify for the OSIPM program? Yes. OSIPM, they can, well, because they pay for a Medicare Advantage plan on top of it. So OSIPM will always be the payer, what we call the payer of last resort. So they can have private insurance, they can have Medicare, they can pay for a Medicare Advantage plan. All of those are going to be billed first, and then if they're eligible for OSIPM, OSIPM will pick up any remaining items. But it doesn't, we're not going to deny someone for OSIPM because they have a Medicare Advantage plan. All right, that's all that was in the chat. Is there further questions? Yeah. Yes,
Hey, Janelle, yes. Got just a couple more here. One's bigger than my screen. I'm trying to just capture it all. Let me pop it in the chat here for you.
Yeah, I see that big one. Oh, okay. So they keep seeing the slides. The OSIPM is full medical. However, what about OSIPM CAWM? How do we know when someone is OSIPM CAWM eligible and not eligible for full medical? I have multiple clients 65 plus who've had OHP CAWM and income less than 133%.
Janelle, I can work up a screenshot of what it looks like when somebody is receiving OSIPM CAWM and maybe add that to the slide deck before I send it out and post it so
Okay,
that people have
so
that.
overall, on the
I think we may have lost Janelle. I can't hear her. Can anybody else hear her?
No, I can't.
Okay. Then let's see if we can answer some of the questions while her audio may or may not come back. Oh,
yeah, you can't hear me at all?
No, now I can hear you.
Now you can hear me?
In theory.
Okay.
We do have a question.
Okay, so the rest of
Go ahead.
that is the difference between full medical and OSIPM CAWM. So, I was just going to reiterate that full medical is going to cover, doctor's visits and things like that. But then the CAWM is just emergency with
And I can send out a screenshot of what that looks like in an eligibility notice or on the applicant portal, so stay tuned. I also see a question, Janelle. The question is, can Medicare Savings Plan program
I think
clients
it's
request?
emergency room care for the most part, hospital care, emergency medical. Yeah. Okay. So yes, there is retroactive medical for some Medicare savings programs.
Janelle, was that answer yes for some Medicare savings programs? Your audio is choppy and has a delay as far as I can tell. So I'm trying to interpret what you're saying. I am hoping you can clarify if I heard that correctly. Or repeat the answer to the question about retroactive for Medicare savings programs. Okay. It sounds like we're probably going to have to answer that after the fact, unless any of our subject matter experts on the call know the answer to that. It doesn't sound like they do. So I'm going to ask David if we have any other questions or if we should move on to the last slide.
No, that was the last question. We were having the queue there, so I think we're safe to move on.
Okay, we almost got through all the questions with Janelle's connection today. I consider that a success. So we will try to get out some of those additional answers. And before we wrap up today, I would like to let you know that the next IE webinar topic is going to be long-term care. So you should definitely tune in if that is interesting to you. I did see a lot of questions about it today. You can register for the whole series on fourth Wednesdays at this webinar link. Next month is actually the last one that is scheduled. I will try to schedule more, but I may have to send out a link for an additional link to register in the future if we're going to continue these. So what we will do next time is we'll ask about additional topics that people might want. This is not intended to be an ongoing series forever, but we will assess the needs and the desires of the community and go from there. But we also wanted to promote a bonus session. So next Tuesday, May 4th, we have our monthly module series, and we are going to use next Tuesday's time to do a Q&A about non-Magi eligibility to further our understanding and our questions. So I would invite everybody to, at least that's the plan right now, I would invite everybody to register for that. The link is down below, and I'll send it out in a follow-up email. And join us for more Q&A about non-Magi eligibility. We are also trying to figure out how to deliver that in Spanish. We don't have a non-Magi subject matter expert who speaks Spanish, so stay tuned for what the plan is. What we've been doing in the past is we translate all of these slides to Spanish and we post them on GroupSite. They are there now. We also have somebody from our team, Fabi, who delivers this presentation in Spanish and records it and posts it in Spanish as well. And to supplement that, we have a transcript of the entire Q&A from all of our sessions that we have also posted in English and Spanish. So we're really trying to make sure you have this information available in multiple forms to listen to or to read, as well as in English and Spanish. And we are trying to figure out the plan for next Tuesday to accommodate that on that short time window. So stay tuned for more information about that, but please do register right now so you're looped into the communications about that. I do see one more question. I'm not the question. Anyway, we are going to send out a follow-up email and try to do a big transcript of the Q&A. So stay tuned for more of that. And is there anything that any of our organizers would like to chime in about before we wrap up today's session? Okay, going once, going twice. Thank you everybody for being here. And we will be in touch. We hope to provide lots of information, and we're all learning together. Have a great Wednesday, everyone.